welcome to SVGTV's news for Friday, January 7th, 2022. I'm Triska Campbell with the details. A surge in new COVID-19 cases continue to be registered on island with another recorded death. A news release issued today by the Health Services Committee of the National Emergency Management Organization said 100 new COVID-19 positive cases were reported from 340 samples collected on Wednesday, January 5th, 2022, resulting in a positivity rate of 29.4%. 87 new rapid antigen positive results were also reported from flu clinics on Wednesday. No patient has been admitted for COVID-19 at the Argyle Isolation Facility. However, 16 were admitted to the COVID-19 ward at the Milton Cato Memorial Hospital, 2 of whom are fully vaccinated and 14 unvaccinated. 1 new death was reported over the reporting period. The latest victim is a 67-year-old female who the news release said was presented to the Accident and Emergency Department on Wednesday, January 5th after a 1-week illness and died of COVID-19 pneumonia on Thursday, January 6th, 2021. The patient, who tested positive on admission, had pre-existing non-communicable diseases. She was fully vaccinated during the period April to July 2021. Her death brings the death toll of from COVID-19 to 84. 106 recoveries were noted over the reporting period. 760 and 36 cases are currently active, and 84 persons with COVID-19 have died. 6,347 cases of COVID-19 and 5,527 recoveries have been recorded in St. Vincent and the Grenadines since March 2020. The Health Services Committee is reminding the public to always wear a properly fitting mask, get vaccinated and boosted, and seek care early. Of 6,000 plus persons here who have contracted COVID-19, just over 600 were fully vaccinated. This is according to Health Promotions Officer in the Ministry of Health, Wellness and the Environment, Shanika John, who on NBC Radio Today said that they continue to gather data which has shown that vaccines are effective against the virus.
We do track, I think at this point we have about 600 some plus persons who have been partially or fully vaccinated and who have contracted the virus. That is not reported on our dashboard, but I will indicate and see if we could get that updated. But we do track once it is indicated at the testing site. We do have some information there.
All right.
And it's still significantly lower versus those persons who are unvaccinated.
Days after schools across the country fully reopened for face-to-face learning in almost a year, a number of students have reportedly been sent home after either testing positive for COVID-19 or being in close contact with a positive person. President of the St. Vincent and the Grenadines Teachers Union, Oswald Robinson, said he is saddened with the situation as it was anticipated that students will contract COVID given the high number of cases in the country. Robinson said that protocols of physical distancing is impossible in schools, noting that washroom facilities are used by all students.
It's very sad, and I'm disappointed that in St. Vincent and the Grenadines, now you have a hype in COVID. We are opening school in full face-to-face. So on one hand, you're hearing the Ministry of Health saying all protocols will be observed. But the fact of the matter is there is no physical distancing taking place in school when all students going back, all classes are going back face-to-face. And that is very sad. So it is already expected that you're going to have COVID, and I have had complaints from parents, from teachers, from a lot of persons about the situation of COVID. And what is sad is that they are sending home just about 8 students, which is ridiculous when all the students would have interacted in some way or the other, whether they're using the same washroom facilities. Yes. In some cases, there are 2 students on a bench, seated.
The Teachers Union president said parents and guardians are to be more aware of what is happening with their children at school and call for mass testing to be done by the Ministry of Health.
Someone fully vaccinated who died. And I am seeing another situation on social media where a baby is in the hospital with COVID, and then there's somebody who's 23 years old. So it is expected that this thing would hit the schools because we have opened up the schools in full without doing any testing. The teachers union has been calling for testing. That's the only way you're going to know if somebody has the virus. You know, we do 1 or 2 tests, and you must get some kind of result to give you proper guidance in terms of what should be done. And there's a big covering up. You know, there's a big covering up. When these cases are being identified in the school, there's a hush-hush, people not saying anything. And that is very sad.
Robinson is of the view that schools should return to online learning with a blended approach.
Well, I would recommend to the Ministry of Education and the government to put a hold on the face-to-face. I think it should go back to the online. I know that when the students went back to school face-to-face, it was a big relief for parents and guardians because we know that the online teaching is not the best. But given the hype that is taking place now, the only option we have now is I should say we should probably do testing, and also we should go back to a blended approach. Because the high traffic of students going into school, a lot of the students riding the public transportation, mingling with other people. You had a lot of parties and a lot of mass gathering over the vacation.
And Health Promotions Officer in the Ministry of Health, Shanika John, said they are aware that children can spread COVID-19 and some measures will be put in place to educate them on how they can protect themselves against the viral illness. John said teachers and parents should also have an educational talk with the children on the importance of following the protocols.
Children are generally classified as super spreaders, and that's simply because the smaller they are, the more they touch and interact, and their form of play and interaction can be a little bit heightened than those who are older. Nevertheless, at this point, it's really important for you to have a conversation with child or your children who are going into school, and we encourage teachers and parents to do that. Over the next couple of weeks, we're going to be working with USAID, who are going to assist us in providing hand soap, hand sanitizers and dispensers for schools across St. Vincent and the Grenadines to ensure that our children have access and the availability of this very important method of preventing infectious diseases in general, which is washing your hands.
The Health Promotions Officer said that her team will also be visiting schools very soon as part of an educational outreach program.
Those officers from the Health Promotion Unit will help to strengthen schools, parents, PTAs, etc., to ensure that they have the information, and will continue to reinforce this particular measure as well as the mask wearing. I think our children are doing better, and we need to continue to encourage them with the mask wearing, with the sanitizing, etc., and even the physical distancing. You know, I'm hearing our children just walking the streets saying, you know, you're too close to me, you need to keep your distance. And this is the conversation that we really want to continue to have among them so that they could understand and take necessary action.
Meanwhile, John is advising parents to be mindful of sending a child to school who is suspected of contracted the virus, noting that this could have serious implications.
If your child is sick, and no, I understand if your child is sick, you may not have somebody to stay with the child. It may have implications for you. But the worst thing you can do is send your sick child to school who who may be positive or may not be positive. And remember, we're not just talking about corona, we're talking about, we also indicated before that we have the presence of the rhinovirus here as well, which is also another infectious virus as well. So we really want to ensure that we contain and slow the spread of any infectious disease right now happening in our school setting or even in our wider population. If you're using a cloth mask at this time, we encourage you to double mask or to go straight N95 mask. For the children who are in school, we've really stressed with our parents and teachers to ask them to ensure that the children are wearing their masks and sanitizing as much as possible, because this is also one of the ways that we could also reduce the spread of the virus in our school setting. And we've also encouraged parents that if your child is not feeling well, avoid self-medicating children and allow them to stay at home to recover. If their symptoms persist, we ask them to seek care with their healthcare provider and their flu clinic.
An investigation has been launched by the SVG police force into a reported robbery that left one woman currently warded at the Milton Cato Memorial Hospital in a reportedly stable condition, nursing 2 gunshot wounds to her right shoulder. According to reports on Thursday, January 6, 2022, at about 8:30 p.m. on the island of Beckway, Cathal Oliver, a 41-year-old sales clerk, was with Select Foods grocery in Port Elizabeth. Beckway was on her way to make a night deposit at the bank when she was accosted by some unknown persons demanding money. She was reportedly shot twice in her right shoulder during the ordeal. She was taken to the Port Elizabeth Hospital for medical attention and later transferred to the Milton Cato Memorial Hospital via the SVG Coast Guard Service. The assailant is currently in police custody assisting with the investigation. The police are encouraging persons with information who can assist with the investigation to contact the Deputy Commissioner of Police at telephone number 451-2467, the officer in charge of the Criminal Investigations Department at 456-1810, or the officer in charge of the Grenadines at 457-1211, or any police station or police officer you are comfortable with. The police say all information received would be treated confidentially. Investigations into the matter are ongoing, with SVG making headway in exporting cannabis flavor products to the European market. Minister of Agriculture Saboto Caesar said this has opened a significant global opportunity for collaborating among member states, with the OECS wishing to participate in the international medical cannabis industry. Minister Caesar was at the time addressing a news conference yesterday where the announcement was made that Cabinet approved the first cannabis export license. SVG is the first member state of the Organization of Eastern Caribbean States, the OECS, to be granted permission for the export of medical cannabis.
And I want to make a call to the other member states of the OECS who already have embarked on a path to establish a cannabis industry and industries in the islands, that we see a clear opportunity for us to work together. We have been blessed in St. Vincent and the Grenadines to have the traditional cultivators who assisted us in ensuring that the framework that was established is an excellent one.
Minister Caesar highlighted the inputs of Invest SVG and the Medical Cannabis Authority for attracting regional and international investors as it speaks of standards, noting that the OECS countries can tap into SVG's resources when necessary.
And because of the hard work of several teams working together, we were able to bring to our shores a state-of-the-art, world-class lab gold standards. And the investors who have entered into a joint venture relationship with the Medicinal Cannabis Authority, they are now able to sell their services not only to the stakeholders in St. Vincent and the Grenadines, but other member states of the OECS and CARICOM in need of these lab services to be able to export. They can come to St. Vincent and the Grenadines and send the product here to be tested.
The Agriculture Minister said the foresight of the government in establishing a medical cannabis industry is now yielding benefits which must be lauded.
Political will was one. Setting the legislative framework is very important. But bringing the factors of production together in a period of a pandemic definitely took a lot of work. And I want to recognize all of the stakeholders in the cannabis industry. You continue to choose St. Vincent and the Grenadines as the jurisdiction for your investment, and the hard work of Invest SVG definitely is making your work easier.
Couriers Hazels Inc., which is one of the longest operating businesses in SVG, has a new managing director. Kevin Dixon assumed the role of the country lead as of January 1st, 2022. He assumed the position after left by Joel Providence, who served the company for over 25 years and retired on December 31st, 2022. In a statement, the company said the new managing director brings to the table many years of experience and leadership at the local and regional levels and has built a reputation for competence and efficiency within the organization, and that there is no doubt under his leadership, Couriers Hazels Inc. will continue growing from strength to strength. Dixon, a fellow of the Association of Certified Chartered Accountants, FCCA, joined the company in September of 2002. He began his tenure as an assistant financial controller and was subsequently promoted to the role of financial controller in 2008. He was also appointed to the board of Couriers Hazels Inc. in 2008, where he oversaw the process of the company's strategic split into Couriers Hazels Inc. and Couriers Distribution Limited in 2015. Dixon has also held the position of division manager for the pharmacy, shipping, and insurance departments. The company said as a member of the senior management team, he worked closely with outgoing managing director Joel Providence and numerous capital projects and company initiatives.